See, it's stuff like this that gives me trust issues.
Welcome to the Trust Issues podcast. We have trust issues with the traditional society-dictated path, with the status quo, with the whole get an education, land a job, and work tirelessly until you're 6 feet under. It's time to upgrade your life with the help of us. I'm Erica.
And I'm Kyle Auckland. We're a husband and wife duo, but we're also entrepreneurs, biohackers, and business builders.
Every week, we're dedicated to having purposeful conversations with each other and leading experts on topics like wellness, relationships, and entrepreneurship.
Subscribe to Trust Issues Podcast if you're looking for bold topics, honest dialogue, and valuable lessons.
Welcome to another episode of the Trust Issues Podcast. We are Erica.
I'm Kyle.
Today we're joined by Dr. Lee Howard, who practices performance and regenerative medicine in Nashville as the medical director of Compass Human Performance. Dr. Lee believes that now there are diagnostic and technological advancements that, when implemented, allow us to achieve our ideal health and live active, energetic, and pain-free lives. He's actually our personal doctor, has helped us navigate our own journey through postpartum, even beforehand when I was really working on my hormones before I even got pregnant. We were seeing you. There's been so many chapters of our life that you've walked us through. And we're just excited to dive into the conversation with you about so many things that I know we're all super passionate about. So welcome to the show.
Thanks. Good to be here. Glad to see you guys.
All right. So let's get into it. We really want to talk about, obviously, you're very passionate about the shortfalls in modern medicine. You have a modern medicine background. We're excited to hear you expand on that. And now you're really working on alternative approaches to getting and staying well. So what has your experience been with modern medicine, traditional medicine, and how that's led you to what you do today?
I'm initially trained as a surgeon, as a general surgeon. So that's a great training to get because you have such a broad appreciation for how disease affects the body, right? Everything from cancer, trauma. And so you get a broad exposure to how disease affects the human condition. So I feel like that was a great foundation for me to build off of, right? To transfer that over into the performance area. But in 2010, I graduated residency. By 2011, I'm showing up to the doctor's lounge every day and I'm looking down and I'm starting to think that I look like that guy over there. And, you know, I'm not liking how this is looking, right? And I started to realize that if I went to my regular doctor, the same practice that I'd gone to as a kid, by the way, that I was going to get the same answers that I probably did not want, right? That a lot of other people were getting. Maybe you work too much, maybe you're depressed. And I didn't feel like, maybe I worked too much. That is definitely could be true, but I didn't feel like depression or what was leading to this, right? Yeah. So initially that led to me diving deeper on nutrition. And I remember giving lectures to medical students on surgical nutrition, which is, I mean, that's definitely its own beast because we're dealing with people who may not eat for weeks or months. Wow. So that's a very unique niche that I had a lot of knowledge in, but at the end of the day, it didn't transfer to usable knowledge as a 34-year-old guy who just had his fourth child and was trying to figure out life after residency, right? That's a whole nother skill set. And so initially I started with really radically changing my diet and then changing how I worked out, you know, and then that then led into hormones. And then it's been an evolution for me. And so in 2012 or so, I started to really like, okay, how am I going to build out the model? Because if I want this, I knew that a lot of other people would benefit from it as well. Yeah. And so how can I start to build out that model? So it took the better part of 5 or 6 years for me to not only acquire the knowledge, right? I used all of my spare time to sort of perfect and listen to podcasts and research articles and, you know, go down some rabbit holes about stuff and to really start to accumulate the knowledge I felt was necessary for me to be able to provide a top level service to people. And in 2018, we launched Compass. You know, in the beginning, Compass took care of a lot of sick people, right? Yeah. We saw a lot of kind of chronic disease and we have really developed our skill set to focus on human performance, anti-aging, longevity, you know, and it's translated or everything that has happened to me has translated into a benefit from our client or for our clients rather, just because of the human condition is so reproducible.
Yeah. So good.
No, because that's when we found you. It was like we moved here and then it was like 18, right? 18, we found you guys and it was like, because we were looking for that same thing. It was like, we didn't want to go down the same road of like, oh, just plug into a new doctor, do this. And it's like, no, we want to go down this road of like, who's going to really help us in the long run and like meet our needs now, you know?
And it's like intangibly, we are both dealing with our own hormone stuff.
Yes. Yeah.
You know, I was a wreck hormonally. really unable to lose weight. I was dealing with such terrible acne. I was dealing with anxiety. I was dealing with just so many things that like I feel like a traditional doctor would just kind of slap on and be like, okay, you probably need like, you know, an anxiety medication. You're going to need to go on a hormone medication, and kind of just like, well, this is just who you are now.
Yeah.
You know, and I would think I was just barely 30.
Yeah.
And I just like refused to accept that was going to be my reality. And I know you can speak to your own journey.
Yeah, so that's where I really wanted to dive in and work with you, because it was like I remember crossing 30, we were considering having kids, and it was like, okay, I want to make sure I am dialed in, because I came from the background of training people, working around the clock, and I knew my health was, I don't want to say declining, but I wasn't where I wanted to be.
Yeah.
And it was like just seeing everything your practice involved and just how you worked with people, and it was, you worked on issues from the root cause.
Yeah.
And that's where I was like, okay, this is the guy I want to be on the same page with. Like, this is the guy who's going to get me where I need to be.
Yeah.
Yeah.
And so many times, there's so much that, you know, we could kind of expand on what you said. So like, first of all, the changes are happening earlier.
Yes.
Right. We know that we're more stressed out when we're younger. We're exposed to more sort of badness in the world. So it's kind of zapping our hormones prematurely. So these changes are coming up earlier than what our parents went through them.
Yeah.
So and most doctors don't recognize that, right? That's a big sort of, I mean, the misnomer is that if the numbers are normal on the paper, then you must be normal. And that's not true. That's just sadly not the right way to look at it. And, but in an insurance model and a model that's going to care for the most people, you have to sort of like have very clear parameters, because it then quickly allows you to triage or move people through the system, right? Our clients typically don't want that. People who are interested in optimal health are definitely not wanting that.
Yeah.
So I think there is a trend, if you will, for people to be more knowledgeable, looking outside of that traditional system, kind of because with skepticism, because they feel like there's not a lot to that anymore, you know, because, well, and I say that we're talking about people who aren't necessarily sick, right? The root cause at our age is typically going to be a hormone imbalance due to chronic stress and lifestyle conditions, right?
Yes.
Bad diet, you know, working too much, you know, there's a lot of factors there, becoming a parent.
Yeah.
So all of those things can be bigger triggers. The loss of a loved one, right? We start to lose our parents at this age.
Sure.
So all of those things can affect how quickly we lose our hormones and how quickly they show up. But yeah, for guys, it's not a real topic of discussion. And for women, it is because of the reproductive aspect of this, right? Like, you know, I tell people, I'm like, you're never going to convince a woman that her child does not have autism from a vaccine. When the child was normal on Friday morning, mom takes the child to get a vaccine. And at 10 a.m., the child gets a vaccine on Friday morning, and the child has some kind of illness after that for 48 hours. And then that child is never the same.
Sure.
You're never going to convince that mother that vaccine was not the sort of cause of that, right? And so it's very hard to kind of get people to see, you know, what the possible causes are sometimes.
Wow.
You know?
Yeah. No, and that, I mean, just backtracking just a second with you there, it's like, I remember the first time I sat down with you and we went over some of my numbers after I got blood work, and you were like, see, this is in the normal range right here, but like,
it's not optimal.
We need to work on this. And I was like,
it's like the difference between normal and optimal. That's what like traditional doctors are looking at normal ranges, but you're like, but I don't feel well, doctor. And it's like, but we're not in optimal ranges.
And
that's right.
Even right now, being 34, I have a ton of friends, family members, obviously, who are men, and they are literally dealing with some of the same things, but they're being told they have normal numbers,
parameters.
But they're gaining weight, they're losing muscle mass, they're, you know, trying all these trending diets, like they're all over the place, and they're not meeting, you know, they're not getting to where they need to be.
That's right. That's right.
Yeah.
Yeah. And there's a couple concepts there. One of which we talk about at the office is update your owner's manual, right? Yeah. Like we all go through phases of life. For guys, it's not as many as for our women. Yeah. And we see that as girls start to go through the change of becoming a young woman and starting, you know, having to menstruate. Yeah. And then from there on having regular periods. And then they go through this cycle of like 25 to 35 is when most women are going to have babies. Yeah. And then 35 to 45 reproduction starts to wind down. Yeah. 45 to 55, you start to lose your hormones in a very fast pace. That's when you're also going to lose a lot of muscle mass in that 45 to 55-year-old age range. And so for guys, it's basically like before puberty, after puberty. And then somewhere around like 55 to 65 for most men, we shift into that sort of third third phase of life, which is where we really start to rapidly lose muscle mass and cognitive function, especially if we don't have our testosterone levels at a peak range.
And that's literally like the road I want to go down right now, is because testosterone is such a huge topic right now. It's everywhere. You click on Instagram, TRT.
And like you said, there's all these testosterone clinics popping up.
Oh, yeah.
Like
Yeah.
there are,
Literally
it's a
everywhere.
thing. I'm seeing them here in Nashville.
But I mean, you can even see, I'm sure you know these, like there's the little statistics out there where they're like the average 30-year-old man has the testosterone levels of a 70-year-old man now.
That's right.
70.
70.
Yeah.
70-year-old
Oh my
man.
gosh.
70, yeah.
Yes.
70.
And it's like, I think I just want to touch base on like, because there is so many people who are like, oh, it's dangerous. Like it is dangerous if your levels aren't right or whatever. And it's like, so I want to hear
What do
your
you do?
opinion. Yeah. Like what would be the right route for, you know, a man, whether my age or even just a little younger, being like, well, maybe this is an option for me. What should I do to, you know, potentially either use this, or is it right for me or not, you know?
Every therapy that you are going to do or every intervention that you're going to consider will have risk and benefits, right? So
sure.
it becomes a balancing act.
Yeah.
And at different times of our life, the rewards can offset the risk, right?
Sure.
And at some points of our life, maybe the risk offset the rewards.
Yeah.
So, but with that said, that's an individual equation that people have to work through. Like I have a 19-year-old kid who's aspiring to be a professional athlete. He has low testosterone at 19 years of age.
Wow.
And so we're faced with maintaining fertility and also helping him be able to compete at a level that he desires to compete at, right? And so he, you know, we run one risk reward equation for him. Now for guys like in our age group or, you know, your age group and mine, we see a difference in how that looks, what that equation is. But largely speaking, I truly feel that if testosterone is properly managed, there's basically zero risk to taking testosterone, right? Like I truly believe that.
Yeah.
Because I just don't see it.
Yeah.
You know, like my guys don't end up in the ER with heart attacks. You know what I mean?
Yeah.
They might tear their biceps tendon, you
Sure.
know, or, you know, blow out their ankle playing football, but they're
Yeah.
not going to end up in the ER, you know, that I've seen, you know, with a heart attack.
Yeah.
So I think there's probably a lot of purported risk, but I don't see a lot of actual risk.
No.
So
yeah.
give us like a scenario, right? Like, so someone comes to you, like you said, they're in their late 20s, early 30s, like where you were.
Yeah, where I was, yeah.
And they are dealing with low energy. They're dealing with, and that the thing that's so frustrating that you kind of shared with me earlier today that blew my mind before we even started recording was that so many men just get dismissed in terms of like with their doctor, because it's almost like men aren't really dealt with, or like they're not really treated until they're like hitting 40. And before then, like what you were saying about that was mind blowing.
There's a comedian who was literally talking about like, oh, when you're in your 30s and you go into your doctor, it's like a revolving door. Like it's like, hey, what are you even doing here?
Yeah,
you know.
yeah.
And then he's like, then you turn 40 years old and you walk in and the doctor shuts the door behind you and he's like, okay, let's sit down.
Now
It's
let's
time
just
to
have a talk.
You know,
Yeah,
and
yeah.
it's like, so
That's
that's
so
yes,
like insane
it's-
to me. Like I didn't even realize that, because being a female, obviously it's so different. But like, so, okay, scenario being, you know, late 20s, early 30s, really dealing with low energy, dealing with like low libido, dealing with a lot of these things. What's like the first thing that you would do with them? Like what tangibly do they need to get a blood draw? Do they need, like, what do you do with that specific patient that, or like if someone's listening and they're like, they don't live here in Nashville, what do they need to go and do and get looked at in order to consider like, am I a candidate for testosterone?
Yep, that's what I was just
So
gonna say.
I think if you, as a male of any age, start to develop the symptoms. So, you know, you mentioned some of them, Erica, about.
And what are
you
some
know,
other ones? Because I don't know.
so
Like,
Yeah,
I
no,
actually
that's-
believe that the most sensitive indicator of testosterone balance is the presence or absence of a morning erection.
Okay.
Yeah.
So most of the time, guys start to hit about 30,
Yeah.
and the morning erections start to go away. Right. So to me, that's probably the most sensitive indicator of testosterone balance.
Wow.
Outside of that, brain fog, fatigue after the gym, like poor recovery. They feel like I went to the gym, man, and it's like took me 2 days
beat the
to
hell
kind
out
of
of
get.
you.
Yeah,
Yeah.
It's like they've been run over by a truck. But, no, low libido, not erectile dysfunction, but no desire for intimacy. Right, that's a big one. Feeling that they're just tired at 1 or 2 o'clock in the afternoon. If a guy comes in and says, "I have low libido and I'm tired at 1 in the afternoon, I feel like I need to take a nap most days," you can pretty much bet that they need testosterone.
Yeah.
Right, like that's a pretty dead giveaway.
Because then the other thing with that is like, I even have some friends, they'll be like, oh, what supplements are you taking to get you back to where you need? Like,
because can supplementation help with that, or is like,
That's what I was gonna say, yes.
is like, what is the line of like when someone actually needs to get testosterone? Like, because I have I'll have women text me all the time and be like, what? My husband needs to know what supplements is
Yeah.
Kyle taking?
Yeah.
It's like, we've done additional therapies with you, but like,
Yes.
what does someone need to do?
Well, we walk through this. So, you know, to answer your question, like we get the data first. We need to have numbers, right? We at least get a starting point of where we are. From there, we take that and start to figure out, okay, here's where you are, right? Let's say your testosterone level is 600 and you're 20. But if you take a level of 600 and a 47-year-old, those are not the same thing, okay? So the strategies that I would employ for a 20-year-old with a level of 600 are not the same strategies that I would use for that other, you know, that other group. And so over-the-counter supplements, you know, we see a lot of them nowadays. There's a, you know, every
Yes.
you know, pharmaceutical company, or not pharmaceutical, but nutraceutical company has their own version of that. I have to say that most of them actually work fairly decently for young men. Okay? So if you're the 17, 18, 19-year-old and you're looking to increase your testosterone, don't go take something that you don't know what it is.
Yeah.
You know, don't listen to the guys at the gym. It's probably not the best thing to do. We can circle back to that about gynecomastia. The fact is that those guys have a high rate of getting gynecomastia from using those more potent anabolics when they're younger like that, and that will haunt them later on. If a guy's going to get gynecomastia at my age, it's typically going to be somebody who already had it in the past.
Wow.
Seeing de novo gynecomastia in a 45-year-old guy that starts testosterone is almost unheard of in my experience.
Wow.
Okay, so. But I also, you know, with that said, I'm very in tune with how we manage estrogen levels too. So I'm aware of what the estrogen balance is because it's important to men too.
Yeah.
So, but anyway, I mean, I think that there's the over-the-counter boosters can be effective, and then you start to look at things like, okay, HCG would start to boost the body's own natural production of testosterone, and then you get into the actual supplementation of testosterone, and we've got several variations of that: pellets, creams, injections, and even oral capsules now.
And then, I mean, even like, what would you say with, because it's kind of like shifting gears a little bit, but like testosterone with women? Like, do you have women who come to you, and like, is that a therapy for them?
Yeah.
And that was something we talked about too. I opted out of it for now, but like we had talked about testosterone for me.
Well, because
But
it's always linked to men. It's like, oh, testosterone, men,
But
men,
yeah, I mean,
men.
women,
But like,
yeah,
women,
Yeah. The only, I've said this in the office and, you know, on other content that we put out about how the only difference with testosterone in men and women is how much of it we have.
Yeah.
But the biological actions that each of our bodies derive from testosterone is not any different, right? Like women need it for libido just like men do.
Yeah.
We both need it to recover from illness, injury, or stress, right? I tell people testosterone is your, you know, get out of bed, fight the bear, kick ass hormone. It's the thing that leads you to kind of get up every day and get through adversity, right? It gives you that resiliency that you need.
Yeah.
You know, it's your body's own natural and only natural anabolic that you have, right?
Yeah.
When you really get down to it. So if we're asking a woman to recover from a femur injury, right, or a patellar tendon surgery or, you know, whatever it could be, isn't it logical that her body would recover better if she had additional testosterone to allow the body to have a boost in that anabolic process, right? Anabolism means to grow and heal new tissue.
Yeah.
So that's what happens after a surgery. That's what happens after an illness. That's what happens after an injury. Your body has to heal and recover. And with testosterone, those things are more possible.
Wow. And I feel like, I mean, just the conversation of fertility, you know, like I feel like, I mean, I'm thinking for men, I think fertility is always spoken around women, but I'm like, you know, a male with low testosterone, how that's impacting fertility. So do you see that with your patients?
Absolutely. Actually, 2 days ago, I had a guy come in, been my client for 5.5 years or whatever. He had been on testosterone before, and we'd always maintain his testicular function on HCG.
Okay.
So he's been on this for well over 5 years, right?
Yeah.
Starts, you know, having a relationship with a young woman. It's time for them to start family planning. Cool. And basically all we did was add clomiphene. Clomiphene or Clomid is a drug that promotes sperm maturation, sperm development. Oh. And within 3 months, he tells me the other day, he comes in to get his blood drawn. He's like, okay, we're pregnant. We're like, I don't know, 12 weeks or something now.
Wow.
So, you know, and he's not not a younger guy in my clientele. He's actually on closer to my age, like early 40s. So he's not someone that is typically starting a family. He's kind of later on that spectrum. But even in that crowd, I have great success with getting men and preserving their fertility. There are times when we get sperm analysis or semen analysis to kind of make sure that everything's okay. Yeah. But we follow those factors, and it's like every time that I meet with somebody, that especially a young guy, that is the topic of discussion. Here's what you're on. Have you been thinking about your fertility?
Yeah,
because
at the end of the day,
that was the first thing you asked
you're
me
like,
when I came
okay,
to
when do you want to start a family? Every time we talk, you're like, where are you at? Last time we talked, you're like, when's second baby happening? You're always checking in on that.
Because I feel like if we're having the discussion, we're not going to miss it. You know what I mean?
Yeah.
You get to make the call. You know what the risk and benefit is, right?
Yeah.
You're going to make the call based off of where you are with your planning, with what your partner says, with how you're feeling. Because after you go through the stress of having a baby, we talked about this before the recording started. There's no class for guys.
Yes.
Being a new mommy's hard.
Yeah.
Being a new daddy's hard too.
Yeah.
We're learning a lot of stuff that's like we've never done before.
Yes.
Right? We've never really been in that role. And so, it's hard for guys to identify with that.
And that's where, I feel like this past year, not comparing journeys at all. I know your journey has been very, all over with postpartum and things like that. But, it's definitely been difficult for me too, because you're trying to kind of find back to the person you were before. Yeah. But also it's like, how do I give so much to my wife and my child by also doing the things that are going to help me, like, advance forward.
That's right.
Like that's the balance it's been trying to find, and you've obviously helped me so much with that. And it's like we were laughing because even when we go into a pediatrician, it's like we've talked about this, is there's always a piece of paper for her to fill out to make sure she's okay.
Am I dealing where am I at the spectrum of like postpartum anxiety
every
and
time
depression?
I'm sitting there just twiddling my thumbs, like
every time
I'm good.
Like when the nurse walks out, Kyle's like, "Where's my paper?" He's like, where's my paper?
Yeah.
Like
every time.
And it's because it's true. We have both navigated so many things. And I think like the conversation is never around the male. It's like, which I'm not taking away what women go through. Obviously, I went through what I went through, and it was one of the hardest seasons of my life postpartum. I love being pregnant. Pregnancy was amazing.
It was great. Yeah, so many women say that.
I literally felt amazing. But postpartum, I felt like I hit the biggest like brick wall of my life. And I just I think that drop of hormones and just so many other factors that we went through. But like you didn't have there's no support that's built in for men at all.
In marriage, I know we're set up like this. You and Kelly are like this. It's like you're a team. So when one teammate is hurting and down,
we got
you have to
pull her up,
pick up more and do. So it's like then that wears you down more. So it's like finding that balance of okay. I remember that point where I was like, it was only just a couple months ago. I was like, we got to go back in and see Dr. Lee.
Yeah,
I'm like, I need to go and like make sure everything is good and like I want to get some stuff done so I can feel my best now for my family and for our career and for those things.
I want to speak for like the women. I feel like at least in our family, I feel like you being a strong man who has energy, who has that like what you said testosterone is, that like go get 'em, like slay the day, like kind of energy. Yeah. Like when the husband is that way, like really, as the leader of our household, like things are smoother. It's like I feel very like that's the dynamic that we operate in the best when you're that way. And so like for anyone who's listening and like maybe their husband, because like I think there's a conversation obviously of like marital roles or whatever, but I think like there's always the masculine and feminine energies. And when the masculine is struggling, like the household struggles.
That's right. Yeah.
And I think that's why it's such an important conversation for men to be able to know like how to take care of themselves. Do I need to get my testosterone levels pulled? I need to go get like a full blood work panel workup done. Like I need to make sure I'm good because it truly does impact the whole household.
It does.
And I think it's just not a conversation that people are having often. I think that the men get looked over because again, like you said, they're not like,
there's no questionnaire handed out at the doctor's office.
Exactly.
Right?
And also I think this is a great point just to piggyback off that is like I feel like a lot of men, even some friends I know, they'll stay away from traditional doctors because they don't want to get either bad news or they know something might be off and they're like, well, they're just going to give me a drug. Yeah. Like, you know what I mean? Like I'm going to be on a pill for the next 2 years.
That's what you do is so important.
Yeah, about Erica, like even though you go to the doctor and they give you this questionnaire, what's their solution?
Yes.
That's
my point.
Yeah.
So like what is the end game? It's basically, it's almost like it's set up to sort of funnel
just
you
put
down
in a document, put in filed away.
to funnel you down an antidepressant highway. That's basically where they're going, right? We've seen the number of antidepressants explode. I mean, not the number of users of antidepressants, right? In terms of how many people are actually relying, if you will, on this, even though the data behind most of them, by the way, is really not good, right? Like there's been a lot of dominoes fall over medicines, not only COVID, statins, the dementia drugs, and then the depression drugs. All four of those big categories of medications have now been proven essentially that the data was very flawed around how it was brought to market. And so they're not even that effective, but they have hellacious long-term consequences, right?
Wow.
Stay on that for 25 years and try to come off of it. Your brain is never the same. So even though they're asking these questions, the possibility that they're actually going to look at the hormones, which are probably the right answer, is very nil. They're going to get that questionnaire and it goes, oh, you got postpartum depression. We're not going to give you progesterone. We're going to give you an antidepressant.
Wow. So talk to us about, you have a patient who comes in and it's like on paper, it's like they are depressed. What do you do in alternative therapies that helps them combat that? What are the answers if they're not wanting? Because I'm saying, with what I went through, to be honest, like what I went through postpartum, I actually, now that I look back, I realize I did struggle with depression. I didn't even realize I was in it then. Now I look back, I'm like, I totally was. But like in my mind, I'm like, well, what's the options for me? Like, well, I'm not going to ever go on an antidepressant. I'm not going to put myself on that. So what would you suggest? What do you have your patients look at?
Look, there's so many facets to this that are kind of like interesting in that symptoms of depression can probably be found in every one of us, depending on what day you take a specific questionnaire, right?
Sure.
That, if we're talking about your father passed away 2 months ago and you just had to go clean out the house over the weekend and then, you were feeling down and gloomy, how many of those people have situational depression and not some sort of ongoing funk of life, right? Yeah. So I think that we overtreated pain, okay, which led to the sort of not fentanyl crisis. It was the other drug. What are you talking about? Oh my gosh, I can't believe I can't think of it now.
Yeah, I know what you're talking about.
You know what I mean?
Yes,
yeah.
I know
anyway,
exactly
so
what you're
the
talking
point
about.
is that OxyContin, right? OxyContin, MS-Contin, right? So it led to this whole boom because we started to make pain the fifth vital sign, right? We started to overemphasize the treatment of pain, and all of a sudden we made a bunch of pain addicts, right? Yeah. So now we're overemphasizing the treatment of depression. The problem is that so many people don't realize that there are seasons to life.
Yes.
Right?
God,
shit's going to suck sometimes.
Yeah.
Okay? It's just how life is.
Yeah.
You're not always meant to be happy. You didn't get married to always be happy. Your relationship is not always going to be rosy.
That is the message pushed on society right now. That,
oh my gosh.
If you're not happy, there's something wrong with you. You got to fix it right now.
Forget that. No way, man.
Yes.
You're not always going to be happy. Your marriages ain't always going to be perfect. And by the way, they say, marriage doesn't come easy. It's work.
It's a lot of work.
I've been married almost 20 years. It's work, people. It doesn't come easy. You know what I mean? I have to invest in that, right? So anyway, I guess the point is that from the standpoint of where people kind of funnel into this, there's a lot of ways that they are led down a path, I think, of this depression sort of thing. And so many women in their early 30s and even more women in their late 30s are going to end up on antidepressants, most likely because they have an imbalance of estrogen to progesterone.
Wow.
So if you look around at so many women who get on antidepressants, that age group is really a big segment where so many women get onboarded to that therapy.
Wow.
So I think that what I first talk to them is like, look, you got to realize that, and a lot of people will come in too, by the way, and they'll start everything with, well, I feel this, and I this, and I that, and I am this, and this is such a struggle for me, and everything's about me. Wow. And there's such a hyper focus on all of the things that are them, and they have no outward focus for their life, right?
Wow.
Like they have no external loci to generate their activities, right? Like we have children. The first person of the day that I'm worried about is not me. It's the 5 other people that I serve, right?
Yeah.
And so when you look at the rates of depression in people who say that I business, it's really stinking high.
Wow.
So I had a young girl come in, she's 19 years old, and they're asking me about putting her on antidepressant. I said, the antidepressant she needs is 1, she needs to go to the gym, and number 2, she needs to go to the Nashville Rescue Mission and start handing out some meals to people that don't know where in the hell they're going to sleep tonight.
Wow.
And her perspective on life will change.
Real quick.
You've got nothing to be depressed about.
Yeah.
That's a hard message for people to hear.
Yeah.
But I told her, I said, I'm not trying to be mean to you, but you don't need an antidepressant medicine. You've sat here in this chair and talked about I. Everything is about you. What are you doing to contribute to the world?
What?
Phew, I'm like, snaps for Dr. Lee right now.
The
problem is that
but it's true.
It is true.
Yes.
It is
true.
absolutely true. Because who else is going to have that conversation?
But
with
I also
them?
think like you have to it's like, okay, look at the lifestyles of people. If I'm constantly like this on my phone all day, I'm not engaging with community.
That was the next
I'm not
thing.
having engaging conversations. I don't feel like I'm contributing to anything, to my family, to my society. I'm constantly looking at everybody else's life. I'm in a bout of consumption
world.
and I'm in consumption and comparison. Of course I'm going to feel depressed because it's all about me, and it's all about me just isolating. I think because of social media, because of the world that we live in today, technology, a lot of people are lonely. A lot of people are, isolated, and that's a depressive way to live.
I literally just saw I just saw a clip on Instagram, and it was some church service. I don't know who they were, but it was actually some younger teenagers. They were giving their lives to Christ, and like I feel like before you'd see them come up and they'd put drugs down on the floor up there or whatever. All these teenagers were coming up and
throwing their phones down. Yeah,
because they were like, "This is my vice. This is what's controlling.
This is
me.
my drug. This is like."
And literally the pastor was like, "Look what we're handing over our phones."
So so my 14-year-old son this was past weekend, and we were driving in the car. I forget where we were going and where we've been, but anyway, I told him, I said, "Put your phone in the door panel, right?" And I said, it's like a 12-minute drive home. I said, let's see if we can go 12 minutes without you touching that phone.
Did he make
I bet
it?
we didn't make it 45 seconds.
No
he reached over.
way.
He said, well, I thought it was going to fall. I said, come on, dude. Like, stop. I said, the problem is that and so then he put it back, right? And it wasn't like 30 seconds later. He reached, and I was like, and he caught himself. And so, yeah, it's like it's addictive.
It's
it's a
dopamine
habitual
hit.
thing. Yeah.
Wow.
Okay, so I want to dive into the conversation around peptides.
Yeah.
Got it.
Yes.
I think that this is a huge conversation that a lot of people are having. Social media is blowing up talking about peptides. There's CJC 1295. There's Epimorelin, Samorelin. I'm just naming the ones that I know.
BP 157.
And now there's a whole semi-glutide is a huge thing that's like taking over right now.
Dude.
Yeah.
So I would love to dive into the conversation around what are peptides, why should someone consider peptides, and then maybe we can kind of dive into a couple specific ones.
Because it's a taboo topic right now. There's people who are for it, and other people are like, "Don't stay away from it."
Yeah, I guess the thing is that I kind of knew that I was doing the right thing when everybody told me I was crazy. You know what I mean? When everybody said, "Why are you leaving regular surgery? And why are you going down this path?" And I'm like, okay, then I knew I was onto something, kind of thing. So I sort of feel like that about peptides too. I feel like there's like this tiny little amount of risk and so much reward or benefit to be had from this. So, you guys brought up a lot of the more common ones. The problem with peptides is not really safety and efficacy, in my opinion. It's more about having to source them, right? It's being able to get some of the good ones that we know that are out there that can really influence human physiology and human capacity. Yeah. They're not that common to find. They're hard to get. So the ones that you guys mentioned, BPC 157 specifically, is a really potent anti-inflammatory and healing peptide. Yeah. So I use that in a lot of ways. I use that with a nasal application that we give to kids who are on the spectrum to help lower brain inflammation after seizures or strokes, something that's happened in the brain or central nervous system pathology. So if we have anything that's cognitive, Alzheimer's, ALS, MS, Parkinson's, nasal applications of BPC are really effective. It's an interesting story how some of these peptides were discovered. BPC has its own kind of story behind it.
What are peptides? If someone's I have no idea what a peptide is.
Okay, so think about it like a car. Okay, a car being a representative of a hormone. That hormone has a lot of pieces. That car has a lot of pieces. Yeah. Independently, some of those pieces can work in another way, right? Like we could pull the tires off the car, put another axle on it, and make a trailer out of it. My point, right? So think of a hormone like a car, and think of a peptide like the wheel. It is a piece of something that has a specific, more sort of dialed in biological function, right? Yeah. And so peptides are many versions of hormones, but are more, designated for specific biological action. So in concept, that's what a peptide is. And then we have peptides that are anti-aging and for brain health and, for growth hormone release, and then, healing and anti-inflammatory properties like BPC. And so, peptides are a good thing, in my opinion. Look, in 2023, the reality is that unless you want to be fat, sick, and dead, you don't have to.
Yeah.
And peptides are kind of like, we place a huge emphasis, as you guys know, in our interactions with our clients on diet and hormones.
Yeah.
Like if you guys come to the office, I have that little diagram that I show everybody, a little pyramid where we are going to perfect your diet and your hormones first, because you could take enough peptides to float a battleship, but if you're eating crappy food, they're not going to reach their full potential.
Right.
So we must kind of stay focused on maintaining the base of the pyramid.
With each other.
That's right.
Yeah.
And so, I mean, think about it from the standpoint of like somebody like Tom Brady. We know how dialed in his diet was. He had, such a long, illustrious career in the NFL, which he would not have had he not gone to the level of detail that he did.
Yeah.
So if you want to be excellent, you do what excellent people do, right? Or if you want to have excellent results, you do the work to get those excellent results.
Yeah.
And so peptides become one of those extra layers of the cake, right? With things like IV therapy, ozone, other types of regenerative therapies that we can use. But peptides can be used for a variety of things.
So good. What are some other popular peptides that you're working with? Like, BP, whatever that one was, that blew my mind, around like a nasal applicator, and that's helping people with brain inflammation. I'm like, what? Yeah. That's so life-changing.
Post-concussion, stroke. Yeah, there's a lot of.
What are some other ones that?
So one you mentioned was CJC 1295, right?
Okay.
So this is a compound that causes your pituitary gland to secrete more growth hormone.
Mm-hmm.
Wow.
And so the natural evolution of this is to kind of see a growth hormone increase over time.
Yeah.
And we typically are using that you can use it in different concentrations, but the most common way that we use it is from a long-term perspective for anti-aging, sort of total body health. We have a lot of experience applying it more acutely, helping people recover from illness or injury and things like that, surgery, stuff like that.
Wow. So is there like negatives? Like if someone's looking at taking them, what are like, if you wanted to take it and then stop taking it, would that be a negative impact? Like, what are like some of the, maybe you said there's such minimal side effects, but do you see any of those?
Not really.
Really?
I have to say that we're also strategic about how we do that, right? So it's typically a discussion that we, have preemptively. We know we've got a game plan ahead, to know what we're doing. In terms of side effects, not really. I just don't see a lot of stuff, I mean, we follow, again, it's kind of individualized, because if you're using it in a young person and you're doing a high dose, we're following some specific numbers. But the reality is that we don't have any evidence that a short burst of increasing your growth hormone to help you get over knee surgery has any long-term effects, even though it could, substantially elevate your IGF-1 levels. The likelihood that there's a long-term ramification to that doesn't seem to be too likely to me.
Wow.
And especially so that's using it acutely, where you would typically say like, okay, that's when you're going to disrupt physiology the most. So if you're going to have a ripple in the pond, it should be at that level. And so the much lower maintenance levels that we use, knock on wood, I don't really see anything.
Man. So good. What about, the hottest one right now is semi-glutide.
Yeah.
Everyone's talking about that. And it's like, it's so extreme. It's either like people calling it the skinny shot, and everyone's like using it to drop a ton of weight really, really fast. And then they're talking about like Ozempic face, people like losing weight really, really fast. And then there's like other people using it more therapeutically that I've seen, talking more about like the benefits to blood sugar. I'm like, it's wild, the sparring that's happening over this one peptide. But can you talk about what your stance on it is on it? Because I do feel that like there's so many people who are struggling with their weight, and they do all the right things. Like me, eat well, exercise, try to rest and recover. Like pretty much everything's like a 99%, like, but
got to be dialed in.
Dialed in, but then still struggling with like excess inflammation, excess weight. So talk about this one.
Okay. So, we have about 2 years of experience in semi-glutide through our office. We use it individually, and then we also use it as part of 3 strategic weight loss, or what we would call cellular overhaul plans.
Got it.
They're not necessarily geared, or they're structured to help people lose weight, but not from the purpose of restricting calories and you're sort of going down some, like phentermine-like pathway that's just going to sort of keep. It's more about a long-term approach to weight loss that's going to take 3 to 6 months, but helping them achieve optimal body composition. So you guys have been on our body composition scale that, you know, everybody loves that thing, right? Like, you know, it's like getting a picture naked or something, you know what I mean? Like, it's just bad.
It makes me so stressed. I'm like, I don't want to see it.
So anyway, we use that to track metrics, right? So for the last couple of years, we've had, gosh, I don't really know the numbers of semi-glutide clients that we've had, because some of them are doing it individually and some of them are doing it as part of a broader plan that includes things like CJC, some of our other peptides, MOTC, which is a good one for mitochondrial rejuvenation. So we combine these peptides with things like semi-glutide to help them get the results they want. So here's what I've seen. I think recently there's been a lot of discussion about the people who are on semi-glutide long term. And by long term, I'm talking about typically somewhere after 3 to 6 months.
Okay.
It seems to be that the first 6 months are kind of like good, and I'll define that in a moment. But after that, or somewhere past that, we start to reach a negative sort of slope on the curve, right? And what I mean by that is this. Let's suppose that somebody wants to lose 40 pounds, okay? Yeah. They're 180, they want to be 140. We would expect that they're going to sacrifice some muscle mass as a result of losing that weight. And you know, I think a healthy percentage of that is probably somewhere around 10%, okay? Maybe 15%. In other words, if you lose 40 pounds, but you sacrifice somewhere around 4 to 6 pounds of muscle, then you are probably at an okay equation. Yeah. Now, past that, though, once you lose that initial 40 pounds, which typically comes off in about the first 3 months, I think, I shouldn't say it, it's probably a little bit longer than that. The first 3 months, our average weight loss is somewhere around 25 pounds. Okay?
Oh, wow.
So
3 months?
In 3 months, yeah.
Wow.
Well, which is, you know, I mean, that's an aggressive weight loss. We're talking about 12 weeks, you know, but that's when most of the easy weight comes off. Right?
Sure, yep.
Like you're going to lose the biggest chunk of your weight, and then it's naturally going to slow down.
Yes.
So now it becomes balancing the weight loss with the muscle loss, right? So in that second 3 months is when we start to get like granular about, okay, how much muscle mass have we sacrificed to lose the weight that we want? And what is the likelihood that we're going to have to sacrifice more muscle mass to reach our ideal weight? Yeah. And now we bring in strategies to talk about, well, how do we stop that muscle loss, right? What's available to us to make sure that we don't sacrifice more? And in some cases it is come off of the drug, you know, for a period of time, let their physiology reboot, and then have them kind of revisit the therapy in the future after they've kind of gotten to, you know, letting their body get back to a normal place. Yeah. Oftentimes it can be with us doing more protein, and then if they're not already, which they should be, if they're not doing some weight-based resistant exercise, and that's when we bring that in. And I think for all of us, we talked about this depression thing, like we have so underplayed the importance of exercise and physical activity. Yeah. And the first thing I told that young woman, I remember I said, was physical exercise and then go to the rescue mission, right? That is absolutely true. Yeah. If you're a woman struggling with postpartum depression, please get up and move. Absolutely. Even if you don't want to, I know you don't want to. I know you think it's going to suck. It's going to feel bad. That is the cave that you fear to enter holds the treasure you seek to find. You have to get up and go to the gym. It's just how it is. Yeah.
I mean, I can speak for that myself. I'm like, if I'm not moving, I mean, gosh, you are like even more than I, but it's like, if we're not moving, we're like, we're not well. We are not okay. Yeah. You mentally, you're not okay.
And I think that's the one thing, even I tell this to some of my friends and just whoever, it's like these practices, peptide, whatever you're going to go down this road.
They're like the extra 10%.
But if you're not implementing the sleep,
the basics,
healthy diet, it's like this, none of this stuff is going to stick. And it's, it could end up, you know.
It's like so funny because like people will message you or text you and be like, hey, what supplements can I take to get jacked? And it's like, bro, scale it back. Like, are you sleeping well? Are you eating enough protein? And do you move your body? And are you like doing something to like take care of your mind? It's like you can drown yourself with all of these extra things, but if you don't have the basics covered, like what's the point?
Well, so and how many supplements do I recommend to people?
And that's something that I always tell people, because our previous experience with working with functional medicine doctors is you go home with a giant list of supplements.
A gym bag full. You're taking
that's going to turn into expensive urine. Congratulations.
If you remember the day we came in to see you the first time, because your thing was like, okay, we're going to do a blood draw and you also bring in the supplements that you take. We brought in a shopping bag full of supplements.
There you go.
Yeah, like it's so crazy to think how many just random stuff we would take. It's so like not your approach, which is so refreshing.
Yeah, because we're better off to take our resources and actually put it again into the food that we eat. Right? I mean, or take away the stress of like worrying about your supplement regimen and instead meditate for 15 minutes, right? You're probably going to get a much better benefit from that, right? Or take a walk, or go take a cold shower for 30 seconds to a minute. You know, you're going to get a much better benefit, because most of that stuff, I think, turns into expensive urine. Now, I'm not saying we shouldn't take it sometimes. Yeah. And I'm not saying that there isn't strategic value to doing certain things. Yes. But at the same time, most of what we overload ourselves on is not really paying a huge dividend. And I think you guys brought up something in the beginning. I don't want to dismiss it, because it's important to the fathers out there, the guys who are in the group, to understand. There was a recent statistic that came out that the fitness level of the father determines the fitness level of the entire family. Right?
What?
So yes, right. So
oh my gosh, that's so good.
It's pretty important, because you hit on it. You said if he's not on,
if he's not on, we're not okay.
The whole house is off, right? And that's been proven by data. That's not something that just Erica noticed. That's something that we notice across multiple households, right? So when you start to think about how low testosterone, right, can affect males, and then what the ripple effects are on our children and the family and society. So we were talking about the mission of Compass. What is Compass designed to do? We believe that men and women need to have strong moral character. We need to have strong marriages. We need to have ability to raise strong children. We need to be healthy. We need to be outgoing. We need to be building big businesses that are going to serve our community. Yeah. And those things are possible when men and women work together, right? Yes. When we have a unique and sort of like a family unit that's geared towards winning, right? Yeah. And the male typically is the head of that. And if you're off, man, it's not going to help the whole family unit. And that's just, and so we believe at Compass that our goal is to basically keep men and women healthy, so that we have tight family networks that are going to be the next generation of our kids and our society.
So powerful. Yes. It's like, it's the realest thing. I think that when you think about the sickness of our society, or the depression that sweeps our society, all of the issues that we have within society, like you have literally just answered so many of those problems within what you just said. It's like having strong, healthy men, having strong, healthy marriages, all of those things would solve so many problems.
Yeah, absolutely.
And I feel like that can't even be stated enough.
No, I totally, and that's it. In this day and age, especially where we're at right now, just in our world, it's like, I feel like men are doing what they've always done, but like money's not going as far. Things aren't, it's only getting harder and harder and harder. So that's where like I will talk to friends and family, and I'm like, you should start looking at some of these options, because you do need to perform at your best. You need to have your brain. I think you even did I don't know if it was on social media or another podcast, but you talked about just how when men would come see you and get on testosterone, you would see them in their business like
make more money.
This happened last week. A kid calls me. He's like, I've been working for the same company for 20 years. I've been on testosterone for 9 months. I got a promotion yesterday that doubled my income in one day. Boom. I said, okay, so tell me, what was it, right? Like, was it the fact that you took on more responsibility? Was it the fact that you showed up with more confidence? What was it that your boss saw in you, right, that made this happen? Yeah. Right? He said all of that, right? Like all of that was the key. So yeah, I mean, look, it's obviously not 100% because people can use their energy for nefarious purposes, right? You know what I mean? Like you can sit around and eat bonbons and, do nothing, right? But the fact is that most men who get on testosterone aren't going to go through the act of trying to be healthy and then screw it up by doing something stupid like that. That's just not how it works.
So this has been incredible.
So good.
Where can people find you, connect with you, and Compass? Where can they maybe potentially work with you guys? Give us all the details on that.
Got it. Okay. So we are in the process of redoing our website. So we're really excited. Actually, I got the latest version last night. We're going to make some tweaks. So our website's going to be updated very soon. But compasshumanperformance.com is where you can find us. We have our office in the Belmead area of Nashville, kind of on the west side of Nashville. And, we're open Monday through Friday. So our phone number is 615-307-7246. So you can call us there to make appointments. We'll also be rolling out a new book online version so that we can have some easier access for clients to kind of get their services scheduled. Yes. But yeah, that's how I would look us up. Compass HP on Instagram, Compass Human Performance on Facebook.
I love it. Amazing. We will send all of our people your way.
We already do.
We already do. It's true.
Yeah, I appreciate it. Thanks for having me, guys.
Yeah. Thank you so much for being on the show. This is fantastic.
Great. I hope to see you guys again.
Yeah, we will. Thanks so much for listening to this episode of the Trust Issues Podcast. If you loved this episode, would you go over to iTunes and leave us a 5-star review? It helps to get our message out to more people. Thanks for tuning in. We'll see you next time.